Prostate is an age-related problem which usually we see in men's aging around in 50 or 60 years of age, and mostly they present with some urinary symptoms like they have to strain while passing urine, their urinary stream gets slow, and often they have to go to washroom many a time. There had been many surgeries had been done for last almost 20-30 years, but the most advanced technique is this laser prostate surgery. What we call it as HOLEP or holmium laser enucleation of prostate.
What are some of the benefits of HOLEP, as we have a lot of traditional methods?
Patient may not have the same symptoms again also. The blood loss in these surgeries is minimum. As such, the pain part, there is no pain at all. So patients, whenever after surgery comes to us, he has a smiling face. He usually gives a very good feedback, and usually the patients have all sort of symptoms free which he was experiencing before.
Welcome to another episode of Urology Unplugged, where we break down complex urological topics into understandable conversation. I'm your host Sonam, and today we have our special guest, Dr. Rohit Kathpalia, a highly experienced urologist based in Karnal city. Dr. Kathpalia has over 21 years of experience in urology, specializing in various treatments including laser prostate surgery. Welcome, Dr. Kathpalia.
Thank you, Sonam.
So first of all, I would like to know what is laser prostate surgery, specifically HOLEP is.
Yeah. See, the most important is first we should know what exactly is prostate and who are people who suffer from prostate problems. Prostate is an age-related problem which usually we see in men's aging around in 50 or 60 years of age, and mostly they present with some urinary symptoms like they have to strain while passing urine, their urinary stream gets slow, and often they have to go to washroom many a times, even in night also. So many times patients come to our hospital, they have these symptoms, we first investigate, and mostly we find that these patients suffer from prostate issues. So coming to the surgical part, there had been many surgeries had been done for last almost 20-30 years, but the most advanced technique is this laser prostate surgery. What we call it as HOLEP or holmium laser enucleation of prostate. So this is one of the advanced surgeries of prostate where patients mostly get all sort of benefits. Their hospital stay is very short, they recover very fast, and the best part is there is minimum blood loss in this surgery.
So, according to you, what are some of the benefits of HOLEP, as we have a lot of traditional methods also available?
Exactly. See, previously most of the surgeries were done either by open methods, or there was some endoscopic surgery which had been done for last many years, which call it as TURP. But now the recent and most advanced form is this HOLEP. This is the holmium laser technique, where the beauty of this surgery is we completely remove the prostate. Prostate is removed as such in total, so the chance of recurrence, so the patient may not have the same symptoms again also. The second part, as I told, the blood loss in these surgeries is minimum. Patients usually have a very smooth outcome, and almost hardly the patient stays in the hospital for maximum 24 hours. And accordingly we discharge the patient, and within 2 or 3 days patient almost is back to his work.
So, as I have seen, there are some myths behind this, like laser surgery is only for older patients.
See, prostate, since it is mostly seen in elderly males, so of course, yeah, the surgery is done in older patients, but the myth like it is only for older patients, no. Laser can be used in any patients, be it a young or children or even in elderly. So there is no any such age criteria.
Oh, that's great. So, is it extremely painful?
No, not at all. See, surgeries always are done under anesthesia. Whenever we do any surgery, the patient is under anesthesia, so patient experiences no pain for at least 3-4 hours. Since the patient is in anesthesia, patient even doesn't know what has been done to him. So as such, the pain part, there is no pain at all.
And what would be the recovery time for it? Is it recovery time takes so long?
No, not at all. See, that is the main advantage, as I told. Laser surgeries have a very short recovery period. There is hardly a 24 hour to 48 hours we need the patient for hospitalization, and the patient mostly goes back to his routine activities within say around 1 week.
Oh, okay. So, for those considering HOLEP, what should they expect while consultation and while having this procedure?
See, first of all, whenever patients come to us, he usually expects that he should get symptoms free totally. There should be no symptoms which he was experiencing before. So whenever a patient undergoes such procedure, the best part the patient experiences is the all the urinary symptoms which he was experiencing, like slowness of urine flow or the straining which he used to do while passing urine. These symptoms mostly gets improved. So patients whenever after surgery comes to us, he has a smiling face, he usually gives a very good feedback, and usually the patients have all sort of symptoms free which he was experiencing before.
Thank you so much, sir, for sharing your valuable insights. Any final thoughts for our listeners?
See, I would like to tell from your side that ideally, whenever any elderly patient who suffers from any such urinary symptoms, they should consult a urologist. They should see him. That urologist will do certain set of tests, and if at all, if required, patient may require surgery also. But the best part is all patients of prostate problems don't need surgery. There are very good medicines also. Many patients are on medicines. For example, almost 60 to 70% of my patients, they are on medicines. So it's not that every patient will need surgery, but if at all surgery is required, I would always recommend HOLEP, because this is the most advanced surgery which we now perform in patients with prostate problems.
Thank you for tuning into Urology Unplugged. We hope today's discussion helped demystify laser prostate surgery and provided some clarity on this important topic. Don't forget to subscribe our channel for more episodes.